Hi folks, welcome to my channel which discusses life topics and also looks at death. I do sometimes paranormal, and when I look at life topics, I share a lot about my stuff. So it's a quite wide, varied channel. So there's lots of different topics. I just thought I would update you. Still have no mobile phone. I've bought one, but it hasn't yet arrived. I also, for those of you who, I'm just going to change glasses. Sorry, I can't see very well. For those of you who have followed my channel, you would have been aware that for over a year I've had every now and then a bleed, and things came to a head well over a month ago. Well over a month ago, I got blood in my urine. I got an after hours doctor telehealth appointment, and they put me on 5 days of antibiotics. Now, a few days after this, I saw my doctor and told my doctor, and my doctor said, "Did they do a urine test?" I said no. So my doctor did a urine test. This was Thursday, the 22nd of July. By the weekend, just backtracking, Friday, the 23rd of July, I have gone to stay with my son in Brisbane. By that weekend, I'm bleeding. Every urine is bloody. And I'm sorry to be so descriptive, but you'll understand why when I proceed with my story. On the Monday night, for 10 hours, I waited at a hospital to be told I had a kidney infection. I was given at the hospital IV antibiotics and given about 20 tablets to take home. 20 antibiotics, that is, amoxicillin acid twice a day, 875 megs by 125, and I'm still on them. And I was given a discharge letter to give to my doctor, my GP, and in that discharge letter, the hospital made it very clear to follow up on my urine test, and also I need to know if I'm on the right antibiotics to start with. Now, just backtracking a bit, when I first went to the emergency with blood in my urine and pain in my kidney, I told them that on the Thursday I had done a urine test because my doctor had asked for it. The hospital followed that test up and it was clear, negative. Apparently you can have a UTI, and for some odd reason you can do a test and it's clear. This is why I put out a video last week that, to just persist. If you know there's something wrong, persist. Because once this germ, which is probably E. coli, was in my bladder, it's now in my kidney, and if I had left it any longer, it travels up into your kidney, into your bloodstream, and you're septic, and that's serious. In fact, you could die. In fact, right now, I'm not very well at all. I'm hardly eating. I've lost a lot of weight. But let me get to the point of this video. Because I don't have a mobile phone, I've had to rely on my therapist to act on my behalf, to take any call. Anyway, on Tuesday the 4th of August, so Tuesday just gone, I went to my doctor's surgery and I gave the surgery the discharge letter. Today I had a telehealth appointment, which means the doctor rang my therapist, and my therapist said, "Oh, did you get Jem's discharge letter from the hospital? Did you read it?" He said, "Yes." And she said, "Well, are you going to follow up? Are you going to do another urine test?" And he said, "No." And she said, "Why?" And he said, "Because the test I did came back negative." Well, days after that test, I had blood in my urine, and every time I was going to the toilet, there was blood, lots of blood. So I am furious. I've now contacted the hospital where I was at the emergency department, and I told them the situation. I got an email back saying, "Well, did you give the discharge letter to the doctor? Because it has very clear instructions for what the doctor to do." And I thought, didn't you read my email? I just told you that I had done that, and the doctor's not listening to you. So I need a doctor from the hospital to ring my GP to tell him. I'm over my doctor. He is not listening. I went across the road, explained there's a medical practice across the road, explained my situation, and they're not taking new patients. Their suggestion, go back to your doctor. Well, what's the point of me going back to the doctor? For on the weekend, he doesn't have set appointments. You just have to wait, and you can wait for hours. So I'll be sitting there waiting for hours, unwell, and by the time he sees me, he won't do a urine test because, according to him, my urine test was negative. He's not listening. After that urine test, I have gone to emergency department where I waited 10 hours for IV antibiotics. And they had on news, I'm in Queensland, that ramping. Now, let me tell you what ramping is. It's where an ambulance comes in with a patient on the trolley, and the ambulance officer has a duty of care to stay with that patient until the hospital can find a bed for that patient. Once that patient is in a hospital bed, the ambulance officer can go. So at the hospital where I was, there were no beds. So there was massive ramping. So that means ambulances with their patient in the trolley. And that was putting a big strain on the system because there's sick people out there who needed ambulances. But they couldn't get an ambulance because of ramping, because the ambulance officer had to stay with the patient. In fact, when I went into the ambulance, I was going to go to one hospital. Halfway there, they turned me away because they were too full. I can't find a doctor. I am sick of my doctor not listening. Another time, this was a couple of years back, went into hospital because I had a severe allergic reaction to Lyrica. After that reaction, long after, I complained of pain, and he says, "Oh, we'll put you back on Lyrica." What the? This is negligence. This doctor, all the addicts go to him because he's the only one around on the coast who's prescribing the opioids. And my daughter calls him a quack. I need a new doctor. But you let me know, is this negligence? A doctor is ignoring a discharge letter instructions. what do I do if I get worse? I can't go back to him. He's not listening. So I go to a hospital, and it's not really, it's a kidney infection emergency. So what's the word? The hospitals are overworked, the system's not working, and I'm just making their work harder. So I would be really interested to hear your story. How's your doctor treating you? How is the hospital system in your country? I know we should be grateful, and I am grateful that we can get free medication, we can get free health care. I'm on a disability pension and Medicare, and I can get bulk billed by Medicare. But our systems are flawed, and no wonder people are getting sick, because if this was nipped in the bud right from the beginning, I would not be so sick. This doctor has known for a year. I've had little bleeds over a year, and every time I've had to ring telehealth, so that's an after hours doctor, and get antibiotics. By the time I get to see him, he does a urine test and it's clear. Of course it's bloody clear, because, sorry, I'm getting worked up, but I would really like to leave a comment. What do you think of the system? I live in Queensland, and there's also, because of the certain medication I'm on, I have to be very careful that if I go from doctor to doctor, that I'm not blacklisted as doctor shopping, because my doctor is the only one who does Buvidal injections, and I need some type of painkiller for neuropathy and failed back surgeries. I'm in chronic pain. I get NDIS for this condition, and I'm quite happy to take Tarjan. So please, if you live on the Sunshine Coast and you know of a doctor who bulk bills, who's a good doctor, who will prescribe this type of medication, can you really let me know? Because I'm a mess. Okay, guys, thank you. Sorry for my anger. Remember, cherish every moment, and I hope you're well. Do not put up with this. I'm going to write to my member of parliament, the health, because I can't. This is wrong. This is so wrong. I'll let you know the outcome, guys, but I have to be very careful, because if I complain, the doctor can stop treating me, and then what do I do? Where do I go? All right, this video is done. Know that I love you. Bye. Please, I beg you, leave a comment. Tell me your story. Let's join together and do something. Bye.